Hey, everybody, and thank you so much for tuning in to this latest episode of The Post. I'm your host, Jade Curtis, the executive editor of BlackDoctor.org, and I am standing here with...
Hi, everyone. I'm Dr. Porsche Johnson Williams, PharmD and certified in pharmacogenomics.
Wonderful. I love that. Ooh, titles. Yes, ma'am. So could you tell me a little bit about yourself and what you do?
Absolutely. I'm an oncology pharmacist by training. I'm also a consultant where I develop programs for precision medicine, help with treatment planning, and also content development as far as educating the community and providers on precision medicine, particularly oncology. And I'm also a medical science liaison with Johnson & Johnson.
Ooh, girl, yes. So that with all that leads me to wonder, from your perspective, from your expertise, what are some things that you wish the Black community knew about health, or even just from your area?
Yeah. So I would say definitely clinical trials are not the last line. They're often better than what's currently standard of care. And in my world of precision medicine, no tests, no drug, right? Because all of these drugs that are being developed in the oncology market are based off of targets of targeted therapy. So biomarkers from the genetic testing, genomic testing in order to have that treatment planning to be eligible for the clinical trials, but then also for standard of care being those targeted therapies that are often better and less toxic because they're more precise than chemotherapy.
Yeah, absolutely. And I actually love the way that you even opened what you just said, is that clinical trials aren't the last line. Is that what you said?
They're thought to be the last line, but they're often better than what's commercially available.
Absolutely. And can you explain why that is? How we can treat clinical trials actually as like a form of care rather than...
Absolutely. I think that clinical trials are often not spoken about in the community, but then also providers don't bring it to the table until they've kind of exhausted all of the options that are currently on the market, which is very unfortunate because clinical trials does have a lot of logistics that go behind it as far as eligibility criteria, making sure there's continuous monitoring for the patients to stay on the drug. And the drug may not work. And so there's a lot of kind of iffy feelings about whether it's worth it or not. But for the ones that are worth it and the ones that actually are better than what's in standard of care, it's life-changing.
Yeah. And so that leads me to wonder, if a patient goes in the doctor's office and your doctor isn't offering you the clinical trial, does that mean it's just not really on the table? Or should you speak up and say something about it?
Absolutely. Advocate for yourself. Advocate for your family members. There's a lot of bias out there. So they may not offer it to you because they may not think that you are able to come to the appointments. You're not able to have the monitoring. Maybe you cannot afford to take off for these trials, or maybe because they know that there's a historical mistrust that you're going to say no. Mm-hmm. And so oftentimes it's not even an option on the table. So you have to advocate for yourself. You have to put yourself first and your family members first because the providers are not always on your side.
Yeah. And I know that you mentioned the mistrust, and we talked about the history. I know we continue to talk about the history when it comes to clinical trials. And I think some people still are kind of caught up in that. So for someone who is kind of hesitant from participating in clinical trials because of that, what would you say to that? Or what advice would you have for them to kind of get over that mistrust?
Absolutely. Ask the questions. Ask the questions. Me personally, I seek care from those that look like me or that can be an ally for me. And I think that's really important as far as establishing that trust, knowing that they do have your best interest at heart. And you may not find that at prestigious academic centers. And you have to keep going until you find someone that you're very comfortable with, of your vulnerabilities, any type of, social determinants of health that may be prohibiting you from getting the care that you should have. Mm-hmm. And just having that open conversation and knowing that you have not because you ask not. But you may not know what to ask. And so I think it's really important to educate yourself and educate others to know those questions to ask, and even for your family members to advocate for them too.
I love that. Have not because you ask not, which really means closed mouths don't get fed. Okay. I love that. And so for some of the people who kind of are interested, maybe they've gotten over that distrust, or maybe they realize hey, I never really believed in that. I do want to do a clinical trial. I haven't been asked. Say that there are some barriers to access. How can we kind of get over some of those barriers that are keeping people from participating in clinical trials?
Absolutely. I mean, I learn every day that you have to advocate for yourself. There's a lot of verbiage that can be implemented in the contracting for clinical trials to allow for you to have transportation support, meal support, care for your children while you're there, or even telehealth where the monitoring is done at home for you. But if you don't say anything, then they're not aware of that, right? And so I think that's really important, just to kind of advocate for yourself of what you need in order to be successful on these trials. And that's where we can kind of go from there. But you have to speak up earlier on, because once you're in the trial, it's hard to kind of negotiate that contracting verbiage.
Yeah, absolutely. Yeah. And so I guess another thing that I wanted to ask, don't slip my mind question. Why is it so important for Black people to be in clinical trials? It's not like it's just about you, right?
Yeah.
Why is it so important to participate?
The number one drug rule, I'm a pharmacist, y'all. So the number one drug rule is to never take someone else's medication. And unfortunately, clinical trials, especially cancer clinical trials, or really, I guess, any clinical trial, is based off of a population that does not look like us. So you're essentially taking a drug that was designed, was tested, and was prove to be efficacious in a population that maybe is not of your same ethnicity. They may not even be, I mean, me as a Black female, I'm a double minority. A lot of these are white men that these trials are based off of. And so unfortunately, we don't have the same metabolism. We're just not inherently built the same. And so you're not expected to respond the same if there was no one in that trial that looked like you, or they could be a representation of your patient population to show that that is proven in your patient population as well.
Absolutely. And so I do want to ask one more question.
Sure.
What is one myth that you've heard about clinical trials that you're like, ooh, please stop saying that? I wish I would stop that.
Yeah. I think because of historical mistrust that you don't know where your information is going, but I will say that education is key. So there is an act called the GINA Act, which is Genetic Information Non-Discrimination Act, that protects you from employers and also from just any type of discrimination based off of genetic predispositions.
Okay.
And so knowing that your information is protected and that for clinical trials, you can pull out at any time. And so that's something that we've kind of been able to sway along the lines as we've kind of gone down this timeline in years, is knowing that you're not bound to a clinical trial. At any point in time, you can remove yourself and with no questions asked.
Absolutely. Well, thank you so much for your time and sharing your insights. I'm so happy you're able to join us on the Pulse.
Thank you. Thank you for having me.
Of course.